So it's all about making the most you can of life. But when things aren't going to go quite the way you really want it, just accept things as they are. And with the insightful approach, being able to write it both from the doctor's perspective as well as my own experience as a patient, so really writing it from both sides of the white coat, if you will, has really, I think, helped me to make it a better book.
So for folks watching right now who are saying, well, what would the doctor's perspective be other than maybe prescribing medicines and telling people to eat right and relax and calm? What is that a little, maybe you can give us a couple of little nuggets of that doctor's insight, since you're the doctor and it's unique to you?
Right. First off, I've, not just being a physician, where again, I've seen people from all walks of life with all sorts of problems, dealing with pain, emotional suffering, decision problems, everything they could possibly think about. I also saw both my parents being hospice patients. I was executor to my father's will, so I do know how a will should not be done. So I know about that.
Right.
And then my experience both in the propane fire and then actually 2 years into working on the book, feeling fine, everything was good. I'm thinking to myself, now how am I going to write this book so that somebody who's going through a life and death situation can't come to me and say, well, doctor, that's easy for you to say, but you aren't walking in my shoes.
Right.
So there I was feeling fine. So I actually, believe it or not, prayed to God to help me out with that problem. The following week, I go in for a screening colonoscopy.
Typical routine.
And just a routine colonoscopy, thinking everything's fine. And eventually, after a couple more scopes and multiple biopsies, I was diagnosed with a form of non-Hodgkin's lymphoma. And
shock to the system.
Which is so I've actually had somebody look me in the face and say, you have terminal cancer. And so fortunately it's a slow growing and very treatable. So I did have in my mind, the advantage of being able to go through everything that the patient goes through. So IVs, biopsies, scans, some chemotherapy, kind of dealing with all of that.